Now we're mixing up the alginate for the upper impression. Now an upper impression is a little more tricky than a lower impression, mainly because the material has a tendency to want to kind of drip down the patient's throat, and it can be an uncomfortable situation if you don't watch your technique. So the important thing about when you're doing an upper impression is always to make sure that the patient has their head tilted slightly forward. So we're loading the tray much like we did with the lower tray. You're going to smooth water over the top to smooth out the material. Now, an important thing to remember is you must load the tray from the 11 o'clock position behind the patient. And you're going to rub a little bit of material on the occlusal surfaces, and this helps eliminate any voids that might occur. Load from the 11 o'clock position from the patient's rear and insert the tray. Have them lean their head forward immediately, and then make sure that you pull the lip down over the tray. Now whenever you're doing an impression, you want to make sure, oh this is better, that the tray lines up with the midline of the nose, and you can see here that it is lining right up with the midline of the nose. Now one thing that's very important when you're doing an upper impression is to be in the right position. Now Heather is in the right position in that she's at the 11 o'clock and behind the patient, but look how high up the patient is, and her elbows are having to overreach. She also isn't in a position to be able to look down the midline of the patient's nose to see if the tray is centered properly. So one error I see a lot is that the patients are too high. So make sure the first thing you do is assess the height of yourself putting the tray in the patient's mouth so that you'll be able to have a successful experience. So we're waiting for the material to set. Again, you're going to use the rocking motion. Sometimes you need to come around to the front and place your finger up in the peripheral area in the vestibule.
Close your lips and blow.
You can also have the patient close their lips and blow to release. If you have a very tight fitting impression, like this one is here, we're having a little issue getting it out. She doesn't want to give it up. So you just have to keep employing the methods of the finger, the rocking, and now it's coming out. And then again, the last thing you want to do, and the patient is actually helping us out here by wiping her mouth off, but always the upper impression is a little messier than the lower, so just make sure the patient leaves with a clean face.